Hi, everyone. I want to answer a question that I get a lot about bladder leaks. And that question is it normal to pee a little bit when I cough or sneeze? Or why does that even happen? So I'm going to say two things because peeing when you cough or sneeze is pretty common, actually. It's pretty common. There are a couple things. It's one of the first signs that you might begin to have an issue with bladder leaks. But there are other factors here that we want to consider because I don't want everyone, if they get a little bit of a leak when they cough or sneeze, to panic and think, oh my goodness, I have to get help for this. I don't know where to get help, et cetera, because that actually is not the case. If it happens infrequently, that's actually something you have to monitor. And by infrequent, I mean a couple times a year. So if it happens infrequently, it's just something that you probably need to just be cognizant of and watch for. Because there's a couple things. If you if your bladder is already pretty full and you've ignored that urge to go, we've talked about urge. If you ignore that urge for too long, just because you're doing something, you're out, you can't get to the bathroom, etc., and then something happens and you get a good laugh or you sneeze, a couple drops might come out. But you can explain that, right? Because your bladder was full. You weren't expecting to cough, laugh, sneeze, etc. so hard. And that's why that happened. But if it happens frequently, there might be an issue. There might be an issue. Generally, the issue is weakness of your pelvic floor. I know we talk about that a lot. There's not only that, there are other things that might factor in, but the first thing that you can think of is, well, have I been exercising my pelvic floor? Have I been doing my Kegels the correct way, number one? And then number two, the right way for strengthening the muscles that I need to strengthen. As as you remember, maybe, let me just say this, so you may or may not remember, but you have uh, different fibers in your muscles. So you have fast twitch fibers, you have slow twitch fibers, right? So just imagine if you were coughing or sneezing, which one would you need? You would need to pull in those fast twitch fibers, say that 5 times, fast twitch fibers, in order to quickly close off those sphincters so that you don't get any leakage. So let's just talk briefly about what we're going to do about that. And this will benefit everybody, whether you leak a couple times a year, whether you leak every week. If you leak every week, it is time to seek help. I'll just say that it is time to seek help. But what you can do specific to this, and we'll talk about just one thing today. There are several things, and I'll talk about them as we go along. But the one thing you can think about doing today is doing your Kegel. Now, make sure you're doing it the right way, right? Because it's a squeeze and a lift, not just that squeeze, and not a squeeze with the stomach and the inner thigh and everything else. No, isolation, pelvic floor. You should be able to feel your muscles lift up in your pelvis, like lower pelvis. It should lift up and almost in isolation with nothing else lifting. If you can do that, what you can actually add in then is to do what we call sometimes quick flicks. So we call them quick contractions. And those are just 2-second contractions. You want to release after each one, of course, and make sure you can release because we don't want a tight pelvic floor. But you can squeeze and then release. So it would be like this. Squeeze, 1, 1,000, 2, 1,000, release. 1, 1,000, 2, 1,000, squeeze. 1, 1,000, 2, 1,000, release. 1, 1,000, 2, 1,000. You can do that 10 times, and you can do it a couple times a day. And then just making sure that each one of them has quality. Each one of them has a relaxation period after. These quick flicks or quick contractions will help to stimulate and strengthen those quick muscle fibers of your pelvic floor muscle. So if this is you, or even if it's not, because they're beneficial for everybody, make sure that you subscribe. Yep, you can subscribe to the channel. Let me know if there's something in particular you want information on. I would be more than happy to answer any question. And I hope that this information helps someone. Until next time.